Whether to have a vaginal delivery or have a cesarean section? This is a question which has been asked to me several times in my outpatients by my patients. We'll discuss the same in this particular video. And the question would be, what did I opt as my method of delivery? Stay with me till the very end and I will explain you what I opted for and why I opted for. Let us first understand vaginal delivery better. So there are three types of vaginal delivery. One is spontaneous vaginal delivery, second one is induced vaginal delivery, and the third one is assisted vaginal delivery. So spontaneous vaginal delivery is simple. That is how nature wanted the deliveries to happen. That is why it created a uterus in which the baby grows for 37 to 40 weeks, and then at the term contraction starts in the uterus, and after a labor of 10 to 15 hours, a baby is born. Simple, isn't it? But it is not as simple. There are times when ladies don't go in labor, and in that case we have to artificially induce labor pain. That is called induced delivery, and it is done by the help of medicine. The third type, the instrumental delivery, which I told you, is when a lady is unable to push the baby out, we help her using a vacuum or a forceps, or there are times when the baby would be in danger if left inside the uterus and we wish to hasten the delivery when the lady is already fully dilated. That is the time when instrumental delivery is used to assist the lady, and that is called assisted vaginal delivery. Now the contractions can be painful, and there are so many times when ladies ask for cesarean section just out of pain. So pain is not an indication for cesarean section. In that case, we can give them the option of epidural or Entonox, the pain relief, which works very well, and that helps the lady reach up to full dilatation and try for a vaginal delivery. Epidural doesn't increase the rate of cesarean section, but what it does is that it increases the risk of instrumental deliveries or assisted deliveries, because the lady loses the sensation to push the baby out because she is feeling less of contractions now because of the epidural. Do bear in mind that when you go for epidural, not always, but there are so many times when you can need assisted vaginal delivery. What are the advantages of vaginal delivery? Well, that is what the nature wanted, isn't it? That is number one, and it is the least invasive method of delivery. The recovery following vaginal delivery is quite quick in comparison to cesarean section. The blood loss in vaginal delivery is less in comparison to cesarean section. A lady can resume exercise quite early in comparison to cesarean section following a vaginal delivery. The risk of having wound infection is also less because there is no big cut as in cesarean section. But yes, there are times when there can be small episiotomies which also can get infected. The babies born vaginally, they have less chances of having respiratory condition which is called transient tachypnea of newborn, which is a transient respiratory distress which babies have if they are born through cesarean section. So in vaginal delivery, the chances of that is less, because when the baby is going through the birth canal, because of the contraction, the collected fluid in the chest and the respiratory tract of the baby, it is all churned out, and that is prevented. Secondly, when the baby is going through the vagina of the mother, the baby gets lots of healthy bacteria, and which helps in improving the immunity of the baby. So baby wise, this is what is helpful in vaginal delivery. Now, is it to say that with vaginal delivery there cannot be any problem or there cannot be any complications? The answer is no. Things can go wrong even in vaginal delivery. One can have a slow labor, or one can have no progress in the labor. In that case, the doctor might need to start you on certain medications so that your contractions get stronger. And despite that, there are so many times that the lady doesn't deliver vaginally and one has to convert the labor into cesarean section. There can be sometime more bleeding than anticipated. There is a possibility of shoulder dystocia where the baby's shoulder gets stuck while being delivered vaginally. That can cause some injury to the baby. Baby can pass stool, which is called meconium, inside the uterus, which can lead to fetal distress. Otherwise also there can be fetal distress by fluctuation in the heart rate of the baby. So all these things can happen while one is in labor. While delivering vaginally, there are so many times that the lady suffers tear, or if not tear, sometimes we have to give a cut which is called episiotomy to enlarge the size of the vagina so that baby can come out without causing much trauma to the mother's perineum. And all these things can happen with vaginal delivery. That is what we are talking about. Now, as we know about vaginal delivery, let's talk about cesarean section. What is cesarean section? It is a major operation, but a beautiful operation which has saved so many mothers and babies in so many years. So how it is done? A bikini line incision is cut over the abdomen. The abdomen is open in layer, the uterus is open, and the baby is delivered from the uterus. And after that, the uterus is stitched back and the abdomen is also stitched back, and that is all about cesarean section. The time taken in cesarean section can vary from 15 minutes to an hour, which you can compare with vaginal delivery, which is anywhere from 10 to 15 hours. So it takes less time. Why should we do cesarean section? It can be done as an elective procedure where we know beforehand that there is no other way but to deliver the baby vaginally, and that is safe for the mother and the baby both. And those conditions can be malpresentation when the baby is breached. That means instead of the head, it is the buttock which is the presenting part. It can be because the mother has got some chronic infection like say herpes simplex infection which is active at that point of time, and that can lead to infection if the baby is born vaginally. That can be a reason for cesarean section. If there is a low-lying placenta or placenta previa, even in that case, one needs to have a planned cesarean section. If the baby is grossly big, more than 4.5 kgs or 5 kg, one would prefer to have a cesarean section to prevent the risk of shoulder dystocia. So this is some of the indications that I'm talking about the elective cesarean section. It is not an exhaustive list. There are so many other indications as well. Now, there are times when the labor is going on absolutely fine and suddenly we found that some emergency creeps in, like the baby's heartbeat gets irregular, or there is separation of the placenta which is called abruption and the lady starts bleeding, or the baby passes stool inside the uterus. If the labor is obstructed, the labor is not going on as fine as we had expected, and it can lead to rupture of the uterus of the mother, or we are trying a vaginal birth after cesarean section in previous cesarean section and we find that the previous scar has given way. All these can be indications for doing an emergency cesarean section. Again, it is not an exhaustive list, but it is just to give you an idea that what all can be indications for cesarean section. Now, what are the advantages of cesarean section? Obviously, it takes a lot less time, as I told you, and also it is the only safe method in so many conditions where delivering the baby vaginally can be threatening for the baby as well as mother. Their cesarean is the one which rescues, and since cesarean has been used, so much of maternal morbidity and mortality and fetal morbidity and mortality has decreased. So cesarean is a beautiful surgery provided we do it for the correct indication. And one such indication is also maternal request. There are so many times when mothers request for a cesarean section despite knowing the pros and cons of normal as well as normal delivery as well as cesarean section, and in that case it is their right to get a cesarean section if they so demand. Now, that was all the good thing about cesarean section, but what are the things which can be a disadvantage? It is a major surgery. The recovery time is more in comparison to vaginal delivery. The time which will take for a lady to recover enough to go for strenuous exercise is also much more in cesarean in comparison to a vaginal delivery. In cesarean section, the average blood loss is more than vaginal delivery, and of course there is chance of the wound incision to get infected, though it happens less frequently, but there is a practical chance of injury to bowel and bladder while the procedure is being done. And postpartum, there is of course risk of having urinary tract infection, DVT, which is deep vein thrombosis, which is formation of clot in the veins of the calf muscle. Baby can have some respiratory problem, like as I told you, transient tachypnea of newborn that can be present transiently, or the baby can have less immunity as compared to somebody who is born vaginally. So now we have tried to talk about normal delivery versus cesarean section in a very objective manner, with its pros and cons, knowing that none is superior to other. What did I opt for? Well, in my case, the baby's head, my son's head, was floating quite high while I was still in labor. So my obstetrician, who was incidentally my aunt as well, she suggested me that it would be better if we go for a cesarean section rather than pull the head of the baby when I was fully dilated. She would not prefer that unless I request for it. And I trust my obstetrician. I had no reason not to, and I went ahead with a cesarean section. I had an absolutely fantastic experience. I had good recovery, and my son is also fine with no respiratory problems or immunological issues. So I did what was right for me to be healthy and happy, and for my son to be healthy. Likewise, that is the whole idea of a birthing process, to have a happy and healthy mother and child, and that the lady and the whole family has a good experience about that birthing and delivery. So listen to your doctor. They have your best interest in mind. Till we meet next time, have a great week ahead. Till then, bye-bye.